Hi, my name is Shelby. I'm going to be your nurse today. Can you verify your full name and date of birth for me? Okay, thank you. I'm verifying the patient orders. Are you on do you have any pain on a scale of 0 to 10? No? Okay. Do you have any allergies? Okay. I'm going to provide privacy, pull my curtain close. And today I'm going to be doing a wound dressing change. I'm going to take out the old packing and I'm going to put new packing in, get it all cleaned up for you. Do I have your consent to do this? Okay. The reason we do this is just to prevent infection and keep healthy wound healing. So, all right, I'm going to raise the bed to my hip level. I'm performing hand hygiene. I'm gonna get my supplies prepared. So prepare all my supplies. I'm putting on clean gloves and I have my wound here with packing. So I'm going to remove the old packing. So normally I would have my gloves on. I'm going to remove the old packing, dispose in the appropriate container. So now I'm going to assess the wound for color, odor, consistency, and amount. There's no eschar, there's no tunneling. I'm using my cotton tipped applicator and with my wound measuring guide, it is, the wound is about 20 centimeters long and 5 centimeters wide and about 4 centimeters deep. And I will throw away these in the proper container. I'm removing my gloves and discarding those in the appropriate container. I'm going to perform hand hygiene. And now I'm going to, at this point, I would put on my gown, mask, all of my protective equipment, and now I'm going to open the sterile field. First, I'm going to grab my gloves. Just open away first towards and then out. Okay, going to set this up. This is our sterile field. It's all set up. Not gonna touch that stuff. Okay, now I will put on my gloves. Do left hand first. Okay, now I will put on my other glove. Okay, so now I have on my sterile gloves, have my saline out. This is for wound. Extra packaging, extra packing. We have our syringe. Okay, so now I'm going to draw up, I'm just gonna pretend, but I'm going to draw up 35 milliliters of the saline in my syringe. And then I'm gonna clean and irrigate the wound. So I'm going to get my saline. I'm gonna clean up going down, and I'm gonna use gauze to catch the debris. Okay, so I'm cleaning. I would do this until the irrigation saline is clear, that's coming out of the bottom of the wound. And then I will pat the wound dry with these gauze pads. Okay. I'm gonna throw this away. I would not want to reuse more than one of these. I'm gonna discard that. And then with my cotton tip applicator that I accidentally dropped on the floor. Normally, if I drop this on the floor, I would have to start over, break my sterile field. But so now I'm going to pack this with I'm gonna put this saline on here, get it wet, and then gently pack the wound. Okay. And then I would apply the dry gauze over. The wound. I would apply with tape. Then I would next use this sticker on the wound and date it with my initials and the date. And then so that completes the wound change. So I will take off my gloves, throw them away, take off all of my mask, my gown, everything else. I'm performing hand hygiene. I will reassess the pain level. What is your pain scale on a 0 to 10? Okay, thank you. I will put the side rails up on the bed, perform hand hygiene again, and the bed is in its lowest position, locked, call light is in reach, and I'm washing my hands again. Thank you.